Last night, as many people know, we got word that we're getting an additional 100 ventilators from the federal stockpile. We'll test them as soon as they get here and deploy them to the hospitals in the Commonwealth based on the criteria and the guidance that was established by the Medical Advisory Group. We also received a wonderful donation from Boston Children's Hospital of 5 ventilators, which we're enormously grateful for. And obviously that is a very special institution that every day provides amazing care to kids, not just in the Commonwealth, but across the country and around the world. Obviously, we continue to be focused on a pursuit of ventilators through other means and other channels as well. Given our projections about how much worse this pandemic could get, we obviously know we need more, and we will continue to work every avenue we can to get them. Earlier today, I signed 3 executive orders to help expand healthcare capacity and ensure access to inpatient services. The first order makes it easier for foreign-educated doctors to be licensed to practice here in the Commonwealth. Specifically, the order allows graduates of international medical schools who have completed at least a 2-year postgraduate training to be licensed here in Massachusetts. The second order allows nursing student graduates and those in the last semester of nursing programs to practice nursing here in Massachusetts if they are supervised by a licensed medical professional. These orders will contribute to our efforts to grow a robust community of frontline workers to support our healthcare institutions statewide as they significantly expand their capacity to deal with the surge. We've already cut red tape to allow more healthcare professionals to come over state lines, come back to work, or start practicing straight out of school, and to continue to make sure that we find the resources that we need to support our residents. This is particularly important as we bring more field hospitals like the BCEC site online, because we need the staff to support this extensive network of operating facilities. The last order I signed provides that insurers cover all medically required costs with no charge to the patient. Again, this order is important as we stand up new facilities for healthcare that may be considered out of network under normal circumstances, and will ensure that individuals will be covered who go to those alternative locations for their medical care. I also want to give a quick update on our efforts to build out field medical stations to accommodate the surge. As we outlined last week, our command centers worked with Commonwealth's medical community to model the growth of COVID-19 cases so we can understand how we'll need to increase our hospital capacity. To reduce the strain on our hospitals, we've been working with a wide range of partners to set up field medical stations at locations across the Commonwealth to add a significant number of beds to our system as we approach the surge. Each site will leverage the unique experience of local healthcare partners. For example, the first medical station in Worcester is being staffed by the dedicated team at UMass Memorial Hospital, and special shout out to Eric Dixon and his team for their work. Today we're here to announce the details for the Boston Field Medical Station at the Boston Convention and Exhibition Center. To launch this site, our administrations worked in close coordination with the Command Center, with Mayor Marty Walsh and his team at the City of Boston, our colleagues at the Convention Center, and of course, Boston's remarkable and talented healthcare community. Today, we're excited to announce that Partners Healthcare will be leading clinical care efforts at the Field Medical Station at the Boston Convention and Exhibition Center. As we all know, Partners has a huge footprint here in the Commonwealth, and the hospitals in its network, Mass General and the Brigham among them, are some of their very best in the world. Partners' clinical effort at the Convention Center is called Boston Hope, and leverages a partnership with Boston Healthcare for the Homeless to care for what we expect will be a large and diverse population of COVID-19 patients. As a result of this clinical effort, the Boston Convention Center will eventually provide an additional 1,000 beds for COVID-19 patients. 500 on what we think of as the medical side, and another 500 to help shelter providers and serve homeless populations here in Greater Boston. Dr. Ann Klebanski, the CEO of Partners, is with us today, and in a few minutes she'll speak to the specifics of the Boston Hope clinical effort. But for now, I just want to say, on behalf of the Commonwealth, thank you for bringing your people, your knowledge, and your innovative spirit to bear in this fight. Partners' workforce and institutions have already done a lot for the Commonwealth's COVID-19 response. And of course, the incredible work of the medical professionals at all of our Boston hospitals will be crucial to the healthcare system's response to this pandemic. Labs at our hospitals have also contributed to a significant increase in testing capacity and output. And Partners, I think, as many of you know, because both the Lieutenant Governor, Secretary Sudders, and I have spoken about this before, was instrumental in the identification and delivery of the machine from Battelle out of Ohio, which is standing up a new facility in Somerville where that critical care decontamination system will be able to sterilize 80,095 masks a day, which obviously means that our N95 mask stockpile will go a lot farther than it would have without the machine. And I do believe there are only 4 or 5 sites like this that are currently set up anywhere in the country. And I just want to give the folks from Partners, the folks from the Mass Hospital Association, Mayor Joe Curtatone and the folks in Somerville, and the folks on our team, a big shout out for making Massachusetts one of the few sites in the country that is going to be able to use a facility like this to dramatically extend the life cycle of some of its personal protective equipment, and in particular those N95 masks for our healthcare workers, our emergency responders, and our first responders. We're grateful for the support from the City of Somerville for their efforts to make this happen. The machine will keep more masks in use, sustaining our supply of this crucial personal protective equipment for all the folks who are leading the charge in the fight against COVID-19. And now with the launch of Boston Hope and this new effort at the BCEC, Partners is stepping up to do even more, and we are very, very grateful. Mayor Walsh and his team have been working around the clock to bring the Boston Field Station and the Boston Convention and Exhibition Center online, and without them, this critical effort would not have been possible. This will also come in conjunction with the opening of the Newton Pavilion, which is a joint initiative between the Commonwealth of Mass, several of the shelter providers in the City of Boston, Boston Healthcare for the Homeless, Boston Medical Center, and the City of Boston, which will also offer another 250 beds to help shelter and care for the homeless community here in Boston. This morning, new data released by the Federal Department of Labor revealed that nearly 140,000 new individuals had filed for unemployment in Massachusetts last week. All in the last 3 weeks, nearly 470,000 individuals filed new unemployment claims. And to put that number in context, typically in Massachusetts, over the course of the past 6 or 7 months, we would get roughly 7,000 to 10,000 new claims a month. So 470,000 over 3 weeks versus what would have been something more in the vicinity of 10,000 to 20,000, maybe 30,000 new claims over a 3-week period under normal circumstances. These numbers obviously are staggering, and we all know the story behind all of them is about more than just numbers. Between every new claim is a story of economic disruption and hardship caused by the unprecedented impact of this virus. We all know the virus has caused people to lose their jobs, almost all cases through no fault of their own, and has created significant anxiety in households across the Commonwealth and across the country. We know several people have had trouble getting through the website and are frustrated waiting for callbacks. I want you to know that the administration is working this one hard, and we continue to expand our capacity and develop new resources to help people who are filing applications. We're glad the online system that we have has been able to withstand the new volume without crashing. That hasn't been the case in many other states, and that's thanks in large part to the work we did to migrate the system to the cloud a few years ago. But the sheer volume of this new influx means we have to do more, and we know that. The Department of Unemployment Assistance has been working nonstop, and as of today, DUA is paying unemployment compensation to over 250,000 Massachusetts claimants. But given the historic volume of new claims, we know that a large number of people are still working through the application process, which often requires, in some cases, a personal connection from DUA's customer service staff. And we recognize that that is frustrating for people, and in many cases, Small mistakes on those applications can prevent a claim from getting processed right away. In a situation where people need to access unemployment benefits quickly, it's crucial that we do what we can to help resolve those issues. And that's why we've aggressively scaled up DUA's customer service staff from around 50 people working in a single call center 3 weeks ago to over 600 people working remotely today. And that team has made over 60,000 calls back to constituents to help them resolve their issues and get their claims and their applications processed. That group is now making over 6,000 calls per day, and that number will continue to trend up as we go forward. DUA customer service staff has been calling claimants basically 7 days a week for the past 3 weeks, and will continue to work through the weekends until everyone receives a call back and gets their issues dealt with.